So in this video, we're going to be discussing two different forms of craniocervical instability. We have structural and we have functional. So this is actually new research that's coming out talking about how there might be possibly different forms of craniocervical instability and how they can affect different disorders like headaches, dizziness, feeling off, and different head and neck symptoms like that. So let's go ahead and dive into it. So let's talk about this new paper that just came out back in October of 2024. So this paper is talking about craniocervical instability and how there might be two different causes. So it's talking about structural and it's talking about functional instability. So we're going to understand how symptoms like dizziness and balance issues, neck pain, headaches, different things like that could possibly come from the upper neck. And then we're also going to talk about different solutions that they have for structural and functional instability. We're mostly going to talk about the solutions for functional, but let's go ahead and dive into it. So let's first talk about why the craniocervical junction is so important. So the craniocervical junction, this is where your skull meets your spine. This is specifically the C1 and C2. So this is the first two vertebrae in your spine, the atlas and the axis. So this area, it does a lot more than just head movement. It's there to support your head, it protects vital structures, and then it even affects your sense of balance and spatial awareness. So we have things like the structures there, like the ligaments. So some different ligaments that we have are the alar and transverse ligaments. These provide stability and keep, the movement safe. And then we have neurological functions. So we have a lot of nerves in that area, including in the study, it talks about the spinal nucleus of the trigeminal nerve, which can play a role in sensations like balance and even contribute to certain types of headaches. And then also we have vascular structures. So we have major blood vessels such as the vertebral arteries, and then we even have other blood vessels like the internal jugular vein, the carotid artery, and different things like that in this area. It's just a very highly dense area. So let's talk about the two different types of instability in this area. So first, we're going to start with structural. What it is we have a physical issue like ligamentous laxity, bone deformities, or structural damage, and this prevents the CCJ from functioning as it should. So, it can compress on different structures and just it can have a big impact on people. This can happen from, they've had some sort of trauma in the past, or they even have hypermobility, like EDS is one example. There's many different examples of hypermobility, but EDS is what a lot of people know about. So you can have ligamentous laxity in this area, and that causes the structural instability to not be stable. And then some symptoms that you can have whenever you have structural instability, it's quite complex, but you can just have chronic neck pain, neurological deficits, fixed deformities are some of the ones that the study that it recognizes, but there's so many more that you can have. There's, headaches, migraines, different things that you can have if you have structural instability of the CCJ. So typically you see structural instability in imaging. So this is something like an MRI or a CT scan, and this is where you'll see that ligament damage or something along those lines that doesn't allow this area to stay where it should and can affect and compress on, the anterior part or the front part of the brainstem. And that's in these severe cases where you need a surgical intervention to stabilize the area. So some common things that surgeons might do is they might fuse the area or do some sort of like decompression procedure. So this is done to help prevent further issues in the future whenever they do these types of procedures. Again, this is more severe cases that you have to do this type of procedures to help stabilize that area. So now we're going to get into the functional instability where these this type of instability is not it's not in you can't see it in the MRIs and the CTs and in the ligaments and things like that. It's a different cause. So it doesn't involve visible damage to the bones or the ligaments. Instead, it's a problem with the body's proprioceptive system. So this system helps your brain understand where your head is in space. The study describes it as informational noise. That's what functional instability is. So this is where signals between the neck and the brain get confused, and it creates symptoms without the physical changes. So some symptoms that this informational noise, this is what the study quoted it as, was informational noise. It can result in general instability, muscle hyperactivity, and dizziness. This is because the brain struggles to make sense of the conflicting signals that it's getting. So this is why the symptoms of functional instability can often feel disorienting, as if your sense of balance is constantly being thrown off. One of the ways they talked about in the study how to measure this is through joint position error. So this is essentially helps us to diagnose that functional instability. So it shows the degree of error in head positioning, revealing how well the neck's proprioceptive system is working. So one of the ways that we can measure joint position error, different it gave different tests and orthopedic tests that you can do in the study. I'll link the study down in the notes down below if you want to take a further look at it. But the way that we measure joint position error is through NeckCare. So NeckCare helps us measure that joint position error to see if there's any sort of that informational noise going on and seeing how well the neck is actually functioning. So I want to say all of this is emerging evidence. So this is all brand new. Like I said, this study just came out in October of 2024. So this is all brand new. This is the first that I've read about it. This is something that we talk about in the upper cervical communities, and I have mentors that have taught me some of this stuff, and they talk about the informational noise of how the brain and the neck they get different signals, and that's where a lot of these symptoms like dizziness, headaches, neck pain, and different head and neck symptoms like that can come in from this informational noise. But this is the first that we're actually seeing it in the literature that I'm aware of. So at the end of the study, it even says more research is needed to fully understand the impact of CCJ instability on quality of life and optimal treatments for different instability types. So, like we talked about for structural instability, surgical intervention in those severe cases is what's needed to stabilize that area. But for functional instability, there's different things that we can do. So it talks about in the study using a conservative care approach first. So they reference like a lot of physical therapy and different manual therapy exercises that you can do for the neck, which is great and is needed at times. What we do in our office is obviously upper cervical chiropractic. So that's whenever we're able to go in and look at these structures, see if there's any small, minuscule misalignments that could be causing that informational noise. So we use NeckCare to measure how well the neck is functioning, and then we use it pre and post. So we want to see how it's functioning before adjusting the upper cervical spine and after adjusting the upper cervical spine. So our goal is to reduce that informational noise coming into the brain to help relieve symptoms such as dizziness, neck pain, headaches, and different things like that. So let me know if all of this makes sense. So just a conclusion on these. So both structural and functional instabilities can impact quality of life. They each require a different targeted approach. NeckCare and upper cervical can offer a conservative targeted solution for managing functional instability and improving stability without surgery. So if you're experiencing different symptoms like headaches, neck pain, dizziness, and you've been to a lot of different doctors and no one's been able to help you because all of your scans and labs and different things are normal, but you feel like maybe there's something going on in your neck, you could have something going on up there, like this functional instability, where it's the noise that's causing your symptoms because your brain doesn't know how to interpret it. So if you like this video and you want to learn more about your neck and how it affects your health, go ahead and click the subscribe button below and let us know if you have any questions. If you're looking for an upper cervical chiropractor that might be able to help you, just comment your location down below and we'd love to find you someone in the area.